I'm Dave Workman, president of Workman Associates here in Logansport, Indiana, Cass County, and welcome to a very special edition of Money Talks. Tonight's edition is going to be the beginning of a special series, Cass County COVID Heroes. And with me tonight, I'm fortunate to have a doctor at Logansport Memorial Hospital, a friend of mine, a neighbor by the name of Dr. Bruce Murray. And I just want to start this off with, Bruce was really hesitant to come on because he doesn't consider himself a hero, but I'd asked Bruce to maybe discuss what's going on at Logansport Memorial Hospital, especially with the uptick in COVID cases that we've seen in just the last couple of days. So Bruce, welcome very much. Thank you for taking time away from your family. And I'd just like to ask you the first question. How is it at Logansport Memorial Hospital right now?
Well, I think we're all a little bit on pins and needles right now. We all had a pretty good feeling that we would see the effects of the virus. And I think we went from kind of having nothing going on to within about 36 hours, we have many admissions, and it's changed our perspective on how we're going to approach this. We've had the luxury of time watching it around the rest of the country, especially. We've had some time to really prepare, and we've used what we've seen from around the country to try and get ourselves ready for this from multiple different sources. We've been at this for weeks, literally, and you can't say enough about everyone that's involved in this, because I do sit on as a department head within the hospital. I'm part of a group of people that are being asked to sit in on meetings regularly on a daily basis, including the weekends. We sometimes will meet more than once a day to discuss where we are with things. And as we go along in our daily routines, we find and have questions that come up that we have to look at things differently, and we have to change how we're doing things almost on a daily basis at times right now.
So you are an OBGYN.
Correct.
And I would like you to tell folks as far as to not stop coming to see the doctors, because the fact that when they come in there, it's important to continue with the appointments that have been set in regards to your particular specialty.
Yeah, for us as OBs, we still are encouraging, especially our obstetrical patients, they still need care. How we're seeing people right now is changing a little bit. We're moving towards spacing visits out in time a little bit further out right now, provided people are stable in their care. But it's still kind of an essential type of care that needs to happen. Now, a lot of our gynecologic care is actually being postponed right now. We're not seeing people, but we're pushing it back as much as we can, as long as it's nothing urgent. And the reason we're doing a lot of this is we're trying to minimize exposure for the people coming into the building and for the people in the building to those people coming in. We want to limit exposure both ways. We want to try and keep the viral load and the burden of the viral load out of the hospital as much as possible, so we have less exposure to it. That includes patients and people that work within the building. We are changing how we approach our surgery right now. We're at a point now, because of where we sit with admissions and with our ICU bed usage, that we're kind of in a stage yellow, where we are only doing emergent surgery essentially right now at this point, because we have to really preserve our resources. So we're being very careful in how we're approaching that.
Are you allowed to speak about capacity like in the ICU right now or in the hospital?
I mean, that's something that's really not something I really can speak to.
Okay, that's fair.
I believe that to really the people that are at the administrative level as far as that goes.
So tell me, in delivery, let's say, what things are being done to protect anybody that's there in the medical capacity and the birthing mother I mean, I don't know, are fathers even allowed in the birthing room anymore?
Well, that's an interesting question, because that discussion has just come up really in the last 24 hours. Since we've had a rather significant surge within the last 48 hours within the hospital, we've had to make a very, very difficult decision to not allow fathers in the rooms now. This has gone out we've gone out and approached families and our patients to let them know what's going on. We've been calling all of those patients that are near or at term at this point, so they're aware of it ahead of time. It's been a very difficult decision to come to this, but again, this speaks to really kind of lowering the potential viral load in the hospital. Things that we've been doing up until now, we are obviously wearing our proper personal protective equipment. So, we're in gowns, we're in masks and hats and face shields, shoe covers, being careful on how we approach things. Up until the time that dads were not allowed, both moms and dads were wearing masks as well. The father was being required to stay in the room at all times. He was not allowed to leave the room or the building. Had to keep masks on at all times. We were checking temperatures every 12 hours, making certain that dads were not showing signs of infection as well. As we move forward, the expectation is that we are going to have moms that are COVID-19 infected. It's going to happen. And in order to prepare for that, we will continue to do what we're doing with our protective equipment. Those that can wear the N95 mask will be wearing those when they're in deliveries. For some of us, myself included, we failed our mask fit test. So we have to wear a special device called a PAPR that basically involves a hood that allows us better protection from exposure to aerosolized particulate within the room. We will be using HEPA filters within the rooms so that we're minimizing aerosolization in the room as well. So there's some really specialized equipment and things that we have to do. We are very close to moving into our new unit, but we're not there yet. But we at least have one room in that unit that has negative pressure, which basically functions as a HEPA filter, essentially.
So after you work, what preventive measures do you take? I mean, is it like you shower at the hospital? I mean, what do you try to do? Because people obviously need to realize that you, other doctors, nurses, I mean, maintenance people, anybody have the potential to have that virus. And what are you trying to do not to
when I go in, I always wear a mask into the building. Right now, we're limited to wearing one mask a day, unless we're involved in procedures and cases that require us to change masks. But throughout the course of my normal workday, I will have one mask. I usually will pick that up first thing in the morning. I will dispose of my one from the day before, change and put it on immediately as I'm entering the building. Continue to wear that mask all day long. We'll leave the building with it, and it doesn't come off until I get to my vehicle. When I come in the morning, I will go immediately to my surgical locker room and change in the scrubs immediately. And I will stay in those throughout the course of the day, and I will change before I come home. I'm not at a point where I feel I need to wash clothing yet, but that's coming. We'll see how this progresses over the next week to 2 weeks, but we're almost at a point where those types of things are going to happen.
So
other people within the building, because of what they do, probably are already at that point where they're having to actually drop clothes in the garage, shower, wash their clothes immediately, just because of how and what they're doing within the hospital.
So we've heard wash your hands 20 seconds, social distancing.
Correct.
Can it at this point, can it be stressed enough? I mean,
No,
as a medical person, what would you for the people that are out there, because there might be people in Cass County, there might be people in California listening to this. What would you say? I mean, you were on the front lines, and as I said, you said you were very hesitant to come on, but you are on the front lines. There's other emergency room doctors, surgeons, everybody there is on the front lines. What would you try to tell the public that's so important to follow?
This is real. I mean, this is very real. And there are people who are getting very sick with this. There are people who, because of their health compromise, are getting very sick and even dying from this. This is very real. You need to take precautions. You need to wash hands. You need to wear masks. You need to keep social distancing happening. You need to limit the amount of time you're spending anywhere outdoors where you potentially are in a public space. So going to the grocery store should occur only once or every once or a couple of weeks. You know what you need to go, you get in, you get out, you don't have contact with people, you keep your distance from people. It's not a social outing for the family. You don't take your kids with you. You really need to be by yourself. We in our own home, My wife is the person who goes to the store. She's the only one that goes to the store. And we try to do it at times when we know that the stores are quieter so that she has less chances for contact with people. We're spending some time outside because we're outdoor people. So
Right.
we do things as a family outdoors. We'll ride bikes, we'll walk, we'll hike. We've used some of our public trails, but we are very conscious of what we're doing as we're doing this. And if there are other people there, we make sure we make a wide berth away from people so that we're not in any way, shape, or form close to them as we're doing these activities.
Do you suggest for people when they go outside to wear a mask?
I think being outdoors in itself is not requiring of a mask, but if you're going to be indoors anywhere where there have been people by or near where you were, yes, you should. I mean, the CDC has made recommendations that people should be in masks. So as you're, going to places that you have to go to, you should be in a mask. I wear a mask at work. My wife, who is not a medical person, when she goes to work, she wears a mask.
That's really interesting. And your wife is not, she's not in the restaurant business or anything like that.
No.
She's just doing it as a precaution.
Yes.
I will wrap this up. I found this really interesting, Bruce, and I can't tell you how much I appreciate this because A, I wanted to spotlight the doctors. B, you've because of our home situation, we've been self-quarantined for basically 6 weeks, but you've made it very apparent that this is real. This isn't New York City anymore. This is in Logansport, Indiana.
Yeah. And we've obviously had a big uptick for obvious reasons within our own community as to why this has happened. The one thing I'd like to say too is I want, especially the people watching this who are local, I can't begin to say enough about the preparation and the work that's gone in by everyone involved at every level within the hospital in trying to prepare for this. I want the community to know just how much work their facility has done to make things safer for them and to make sure that we're prepared for this as best as we can. We're a small community hospital and we have very limited resources, but we've spent a lot of time working towards this. And, if I could, I want to just kind of, tell you what I've seen from our ER physicians and our hospitalists who are working the floors, the people that are really doing most of the groundwork, and they're nurse practitioners as well. They're the people that are admitting these people and caring for these people. We have a whole dedicated nursing staff on our medical unit in a COVID unit now that they're locked in that unit all day long. They're there all day.
Wow.
And you never thought that they would come to this in our small community, but
Right.
we're no different than anyone else's. And this is really happening here. And it's going to have a big impact.
Well, Bruce, I see you and I see Dr. Weinstein take off every day, and I think about what you guys are doing, and I realize that there's a bunch of you doing that. Yeah. And it's good to hear that we're as prepared as our hospital can be. And I just thank you very much for tonight. And I encourage folks to not only take what Dr. Murray has said in regards to social distancing, but as a man of faith, I would ask you to pray for our healthcare providers in Cass County and also around the U.S. until there's a vaccine or until the virus at least leaves as it is right now. So, and I think that's going to be some time, Bruce. I mean, I think
we're just really seeing our surge right now, and it's gonna be time.
Very good,
well.
Bruce. Thank you so much. Stay safe, and we'll see you around the hood.
All right. Thanks for having me.
You bet.